A deadly outbreak next door and a global health alert that's now ringing across borders. Hello and welcome to NewsX. I'm Kashish Dhawan. This is not just a public health story. This is about numbers, vaccines, and a virus that spreads faster than most diseases we know. Bangladesh is currently facing one of its worst measles outbreaks in decades, with over 250 reported deaths, most of them children. According to official data, between March 15 and late April alone, 43 confirmed deaths were recorded, while suspected deaths crossed 216. And the even more alarming part, over 91% of the cases were among children aged between 1 and 14 years. The scale of the outbreak is massive. The virus has now spread across 58 out of 64 districts in Bangladesh, covering all 8 administrative divisions. This is not a localized cluster. It has become a nationwide health crisis. And the biggest reason behind the surge, a sharp drop in vaccination coverage. Bangladesh once had strong immunization numbers, but reports suggested that vaccination rates for children dropped drastically to nearly 59.6% in 2025. The last major nationwide measles immunization drive was conducted in 2020, and a planned campaign in 2024 was delayed due to political instability. That gap has proven costly. Now, here's why it matters beyond Bangladesh. The World Health Organization, or WHO, has issued a warning, calling the risk of cross-border transmission high. This is because measles is among the most contagious viral diseases capable of spreading rapidly wherever immunity gaps exist. The WHO has specifically flagged major Bangladeshi cities like Dhaka, Chattogram, Sylhet, and Cox's Bazar as high-risk transmission hubs. Now, these are not just urban centers. They are major international travel and transit points with constant cross-border movement. India in particular has been identified as a vulnerable zone due to busy land crossings near regions like Jashore and Chapainabang. Add to the fact that India saw a spike in measles cases between 2022 and 2023, and the concern becomes more real. Now let's look at India's number. According to government and WHO UNICEF estimates, India's measles rubella vaccination coverage stands at approximately 93.7% for the first dose and 92.2% for the second dose in 2024-25. Now that's high, but it is still slightly below the WHO recommended 95% threshold, which is needed to fully prevent outbreaks. India's universal immunization program, it provides 2 doses. First between 9 to 12 months and the second one between 16 to 24 months. And there is also the MMR vaccine available in the private sector. Now here is the critical takeaway from this. Experts have said that because of this relatively high coverage, the chances of nationwide outbreak in India remain low. But again, low risk does not mean no risk. India has seen how quickly things can change. In 2021, measles cases were around 5,700. 2022, they surged to over 40,900. 2023, cases climbed further to over 65,000 before dropping to around 18,500 in 2024 after aggressive vaccination drives, which clearly tells us one thing. Any gap in immunization, even temporary, can lead to sharp spikes. And that's where the real concern lies. Because measles is one of the most contagious viruses in the world. One infected person can spread it up to 18 others. And what makes it more dangerous is that a patient becomes infectious even before the symptoms appear. Now the symptoms, talking about them, it begins with fever, cough and red eyes, followed by a rash, but in children, complications, they can turn deadly. During outbreaks, mortality can rise to 5 to 10%, and there is no specific antiviral treatment as of now, which is why the vaccination is the only real shield. And the WHO recommends at least 95% coverage with 2 doses to fully prevent the outbreaks. India, it is right now close, but not completely there. And this means that vigilance becomes critical, because what this outbreak shows is simple. When immunization drops, even briefly, the virus finds its way back. For India, the takeaway is very clear. The country has strong immunization backbone, but it cannot afford complacency. Surveillance systems, early detection, rapid isolation of cases, and continued vaccination efforts will be absolutely crucial, especially in border states and among populations where vaccination coverage may still be uneven. Because with a virus like measles, the margin for error is extremely small. Even a minor dip in vaccination, even a small cluster of unvaccinated individuals can quickly turn into a local outbreak. And that is why this is not just Bangladesh's crisis. It is a regional warning, a reminder that in public health, distance does not guarantee safety, and preparedness is the only real defense. Thanks for watching.
For more such videos, subscribe to the NewsX YouTube channel, hit the bell icon.